Welcome, everybody, to Deed and Region 5's second negotiations town hall since we've had opener. And with us today is Gabe Perkins and Kirsten Peterson. They are both on the Healthcare Coalition. And some of you may recall Kirsten from when we did listening sessions back before opener about healthcare, and she listened to all your concerns. And now she and Gabe are going to bring us the concerns that we're seeing with MMB. So I'm going to kick it off to them to give them a chance to introduce themselves. And for those of you that don't know me, hi, I'm Maureen Dunaway, and I am the Deed Meet and Confer Chair and a negotiator with the team as well. Gabe and Kirsten, take it away.
Ladies first, Kirsten.
I was going to say, you can go ahead. Hi, everyone. I am Kirsten Peterson. I am one of the folks who is on the Healthcare Coalition with Gabe here. I work for the Department of Health at present. I am a health insurance investigator. So I investigate people's complaints about their health insurance companies when they don't do what they're supposed to do. Actually worked for Deed for like 4 years. I was in voc rehab. And so I see a few names that I definitely recognize from that time, and you all have my sympathies. I know it's been a rough few months over there. So that's me. Gabe, go ahead.
Hi, everybody. I'm Gabe Perkins. I am one of your regional. I'm a regional negotiator for Region 20 out of Rochester, Minnesota, and I work for the DOT. And so I'm serving on the Healthcare Coalition team with Kirsten. It's been I'll have to admit, very depressing, very frustrating sitting there. And we'll get to the economics here in a few minutes. And besides, how could we say no to Maureen? So we're here to support Maureen in any way we can, and the rest of you. And it's been an interesting few weeks, I can tell you that. And the fun is just beginning. Let me tell you that right now. So what would you like to learn first? Would you like to learn a little bit about healthcare economics? How about get a thumbs up for applause? Woo! Well, come on, you guys. It's not that boring. There. Thank you, Michael. Okay. Well, let me share our screen here. If I can find it here. Oh, where the heck did it go? There it is. Perfect. All right. Let's see here. I've got a new laptop. So here are just some basic things that we wanted all of you to know. Mainly to share with you the big impacts. Somebody throw me out a big number up in the upper 90s, and the upper million. What do you guys think? Can you give me an upper 3-digit multi-million-dollar number that you think our healthcare savings will be short this year? Okay, thank you for playing. $290 million is what CGIP came and told us 2 weeks ago. We had an economic meeting with them where they shared with us our figures. So what that $290 million means is we would need to have $290 million to meet our actuarial value. And Kristen, being the healthcare guru she is, she can tell you much more than I can from the health economics what that means. But basically that means is making sure that by the time they collect enough premiums, co-pays, that's what they would need to have our healthcare plan solvent. That's $290 million. So that was the first depressing thing. And the reason why that happened, folks, is costs got way out of hand last year. Even their consultants, Deloitte, and even Health Partners and Blue Cross Blue Shield, the groups that do this for a living, all their numbers were wrong. The healthcare expenses exceeded what they collected. Sorry, that's my dog barking at the mailman. You'd think they'd be friends by now. So last week they brought to the table what those impacts would be. And so if you go to the healthcare or the MAPE page under contracts and you look at the healthcare summary, this is just a snippet. If nothing changes, this is what you and I and our families would end up paying. So the way to look at this is the state's fiscal problem, whether it's raises or whether it's going after us in premiums, they are trying to balance the budget off the backs of you and I, the worker. So when you look at all these pieces, we're looking at 160% increase when it comes into your out-of-pocket healthcare costs. So when you're looking at basic premiums per month right now in 2025, you're paying $41.84 premium coverage per single family coverage or single person coverage per pay period. 2026, if there's no change, you'd be paying $48.87. If you were to look at 2026 with CGIP proposes, that's $127. So that's going to be a 160% increase. Now, where it really gets rough, folks, is under your family premiums. I feel like I'm selling a policy here. 2025 right now, to insure your family, we're looking at $285.42. 2026, if there's no change, you'd be paying $333. But then if you look at their proposal, you'd be paying $506.40 in increased costs. So that's a 77%. Now, here's where they're going to come after you. Not only are they going to go after you under your premiums per month, but your cost of your copays, your deductibles, your outpatients, your RX drug copays are going to go through the roof. So if you look at your current deductible, anywhere from $400 to $800, it's going to go to $100 to $200 or $1,000 to $2,000, 150%. So over the course of time, pretty much everything what you made your last 2 fiscal years with the raises based on our past good contract, you're going to pay it all back. So get your wallets out, start writing checks out to the state of Minnesota. If we accept this, this is how it's going to impact us. So basically, when it comes to your overall contract negotiations and your health care, management is trying to take all the rights back, and they're trying to balance the budget off the backs of you and I. So that's the depressing part. The good news is we don't have to put up with this. We meet with them again tomorrow. We are hoping they have better numbers. The numbers they gave us last week, Kirsten and I were like, they're full of it because not all of it added up. So there's still some time, but the legislature has until May 19th to have a budget. So right now, until the state has a budget, there's not a lot of negotiating room, folks. But we wanted to share this information with you and to start telling you to fight back. Call, email your lawmakers, tell them that they need to fund these agencies, because when they look at $200 million, $290 million, that's how much the agencies are going to have to absorb these costs. And we know how they're going to absorb it, and that's through most likely layoffs and cutting programs, which they're already doing. So the healthcare is very bleak and depressing. You all might want to call I'll call the mental health helpline after reading these depressing figures. But like I said, we don't have to put up with this. We can fight back, and we will fight back. But it's going to take you and I to make a strong message together, even if it means to go out on strike, folks. I hate to say it, but this is this issue is very important to the majority of our members, and it does have an impact. Kirsten, you want to liven it up with some more economic information?
Oh boy, I don't know if I can. This is. I'm gonna share my screen here and share the details. If you want it for folks who are curious about the actual breakdown of this. So this is what, again, these are proposed changes from management, right? So I'm going to really just flip between 2 pages a lot here. I'm going to flip between their changes to our plan design that you can see on screen right now. When I say plan design, I mean the design of how our copays, coinsurance, deductibles works, how our pharmacies work, to Patty's point in the chat. These are substantial. We have never had a first dollar deductible on our prescription drugs, and they want to introduce one. So Gabe mentioned earlier the costs that MMB has provided to us on this. They are incomplete at best, the numbers that they gave us. They're saying that this is going to, quote, save agencies $130 million. I want to be clear that $130 million is being saved on your paychecks, right? This is costs to workers, not savings to agencies. They only could provide us about $60 million in how much this chart that I have up right now would save. So they couldn't even, can I make the screen bigger? I can try. Oh, I don't know if I can make it any bigger. How's that look? That's about as big as I can go, I think, and still keep it on screen.
Yeah, you can still see some of it. Yep.
Okay. Okay, so that $130 million anyway, they were only able to account for about $60 million of that. So we are eagerly awaiting their complete financial proposal because we want to know where this all comes from. They said about 40% of our expenses from the last year comes from hospital services, which is not unexpected. We all know we have an aging workforce. And so with an aging workforce, that does mean increased costs. That's just how actuarial stuff works, right? It does not need to increase this much. It certainly does not need to increase this much on the worker. And then the second page that I want to talk about here is our actual costs that they want to increase. And this is just for the first year under the plan. They did not put the numbers in here for 2026 because it would be an additional 11% on top of what you're seeing here. So they really don't want you to know how much this would impact you. There's also some, I'm going to call it propaganda going on here from the employer. So when you see this, I'm going to try to bust this up for you. I'm not the best at this. The DEED folks who have been at DEED for a while will know. So hopefully you'll forgive me here for my clunky way of explaining this. But they are saying that if you're on a single plan, they want to raise your cost 8%. If you're on a family plan, they want to raise it 5%. That is versus the 16.8% that it is projected to increase next year. That is really misleading. The 16.8% would result in like going up a few bucks for the single plan and like 35, 40 bucks for the family plan. That's 16% normal scheduled, right? This 8% increase on a single plan is instead of going up to 44 bucks, it's going to go up to 108. So I want to be clear, like this is employer propaganda that we are seeing here. It is, I was in a meeting with Region 17, which is St. Cloud, and somebody in that region likened it to misleading car salesman tactics. So I just want you to keep an eye out for that when you see these numbers. This 8% is not really 8%. It's 8% of the total cost of our healthcare, not an 8% increase. So just keep that in mind. Yeah, Patty, exactly. It's like, it's hard for me to explain, and that's by design. So I just want folks to keep an eye out for this manipulation. And when you talk to your coworkers who aren't here today, let them know that these numbers from the employer are very misleading, because I think it would be easier to take a 5% increase than it would be to take a 16% increase, but it's not measured against the same numbers. So I'm going to just stop sharing here because I think we probably beat this home quite a bit. So I'm going to look at the questions in the chat that we have.
Yeah, there's some good questions in there on the financials, how much wiggle room we have. And my response to that right now is not much, because the state doesn't have a budget. So most likely that'll happen in push week. Karen had another great point about, normally our healthcare costs are within line because of we don't pay as much in premiums compared to the private sector, as we don't make as much. But MMB was very clear reminding us that they pay 90% of the premiums and that we're overpaid, and even other state or at least other county and city groups are paying less than we are. So that's the argument they're making. We can call them on the carpet, of course, but that's kind of the trend we're seeing, is we make too much money and we're not going to absorb these costs, and you're going to get out your wallet. That's the tone we're hearing, folks. Mary, you have a question?
No, I just have a comment, and I put it in the chat. But the more dues paying members we have, the stronger we are. So I'm regularly getting postcard from, I guess it's a billionaire, saying if I stop paying my dues, I'll have more money. And this is a great example how our dues are cost effective to try to fight what they're proposing. If we had no union, look at where we would all be. We would just have to go with what they're proposing. And so, Maureen, Gabe, Kirsten, do you want to comment about how the people do look at the percentage of dues paying members there are and how that brings strength?
Yeah,
Go ahead.
Oh, okay, go ahead. Take it away.
Some great news that we've heard. I haven't seen the actual numbers lately, Mary, on this. I'd have to get those in detail, but from what I understand, the fact when the telework announcement came out a month ago, when people had seen the first bargaining unit or coalition update with what management provided us and all that, our membership actually has gone up. We've had a lot of people show up, a lot of rallies, so the unity is there. And like we've heard at meet and confer events and other events right now, we're probably more solid than we were 5 years ago. To get that many people to show up at the governor's residence on a Saturday, and we had not even a day's notice to organize it, was amazing. And so I don't know the actual numbers per se, but I do know that overall our numbers have gone up significantly because of how much more united we are because of these very issues. These issues are igniting a lot of issues. A lot of people have concerns about these.
Yeah, absolutely.
Okay, that's good to hear. And just, it would be nice to know the actual statistics though, because I think we're still at, 60%. And so 80, 90 would be a lot better. Sorry to interrupt, Kirsten.
No, I was just going to say, I have two thoughts on that question. First is that MMB absolutely monitors our dues paying member status. Like, they look to see where our numbers are at to gauge how much support we have for stuff. So if you do not support these healthcare plans and you are not currently seeing dues being deducted from your paycheck, please join us. We need you. Like, your coworkers need you. Your union needs you. You are important. You matter. Your voice matters. Your vote matters. The second thought that I have, and this is only one that hits Indeed heavy regions, is Mary mentioned the billionaire who is funding these anti-labor efforts and sending you postcards and drop your, you could save whatever, $400 a year. That billionaire is Glenn Taylor. Glenn Taylor owns the Star Tribune. Does anybody in here know who the CEO of the Star Tribune is? I'm asking Deed folks primarily.
Our former commissioner, Steve Grove.
Yeah. Yes. Yeah. And what does Steve Grove think of public sector unions?
He wishes we weren't necessary. He told us that on our first day with him.
Yes. So whenever you see those mailers that come in, and they're coming from the Heritage Foundation or the
Freedom Foundation.
Freedom Foundation, that's the one.
I think I've gotten 5 this year.
Yep, that is coming from Glenn Taylor, who personally recruited and hired Steve Grove to head up the Star Tribune, and then gave him a special title because he's a special boy. So I liked Steve as a human, to be clear. We got along all right back in the day, but not trustworthy when it comes to the working class. So yeah, paying your dues is super important because we have to show. Steve Grove was the commissioner of Deed for 3 or 4 years. So the Deed folks here will who have been around since pre-COVID will remember him. Yeah, he's a bit of a used car salesman, venture capitalist.
I'm seeing a couple other pieces outside healthcare too, just negotiation updates, management regarding 100% and the telework. Just so all of you know, the telework agreement or the telework policy is going into effect June 1st. We did have a meeting. Our union president, Megan Dayton, had a meeting with the governor a week ago last Friday, and he is pretty much buckling down on his June 1st order. And so now there's multiple ways we're looking at this. Number one, fighting it through your meet and confers. Agencies can ask or submit a request to MMB to postpone the delay until fall. It'd be interesting to see if your management team will do that or not. I'll be asking my management team at DOT to do that today. The other aspect is it's still in our negotiations as part of the master negotiating agreement. But he's been very public about it, that he is doubling down and that May or June 1st will go into effect. So could he change that 50% to 100%? Yeah, I mean, who knows? He changed this without telling us. What's to say he's not going to do it at 100%? We don't know. And so, again, the best thing you can do is send emails to your lawmakers about the budget, about the telework, and even his office, and have him feel a lot more pressure, and then also continue to work through it with your meet and confers in your agency.
Push Week is the week of June 23rd, provided, and this is important, provided that we arrive at a budget prior to that date. Otherwise, we'll have to push it out.
Yeah, that's a good point that Maureen shared, is that is push week. By law, the legislature has to have a budget by May 19th, which is, I believe, next Tuesday, close of business. So the chances of them coming up with that might be pretty tight, if not impossible. The other aspect we have seen or heard about is if they don't have a budget, they can go into special session right away to solve a budget crisis. The other thing that's lingering, that's really driving this, are all the federal payments that aren't coming our way with health. So they can have a budget right now, May 19th, but that budget may change throughout the year. They might have to have 2 or 3 different special sessions this next year to balance the budget. So that makes things much more complicated, folks. So our push week, as a result, that might change. If we don't have a budget at the end of May, who knows, the push week could be July. I mean, I hope it isn't July or August, but that could change. It could easily change. But we'll keep you posted.
Some good news I can bring is that at the last round of negotiations, we did drop all of the union busting layoff language that they had proposed, and the modifications that they wanted to make to leaves of absence, like the leaves of absence you would have for medical, like an unpaid medical leave. They were going to try to limit that. They were trying to make a May language. Yeah, right. And they wanted to limit how many times you could be out for the same condition. Basically, you'd get one shot at being out for a condition. So if your cancer comes back, I guess you're SOL. So we did get them to drop that language, and we're working towards some other language. And it's going to be a slog this year. So we're going to need you. We're going to need you to stand behind us. We're going to need you to, come to the rally, to make those calls, send those emails, because this is a contract we're going to have to fight harder for than an average contract. And we already fight pretty dang hard for those average contracts. So just keep in mind that we would just have this imposed on us if we didn't have a union. And we do have the ability to fight back against this. And we should be, because this is horseshit, to be blunt.
Sorry, got the label.
There are people that had the privilege of being able to hear Marsha Howard from Minneapolis Federation of Educators on Friday come talk to the meet and confer that were able to meet with us on Friday. And she basically said to us, they're going to portray you as greedy. They're going to portray you as overpaid. And we all know that that's not true. There's more of you than there are of them. And don't settle for less than you deserve. And she said it forcefully and emphatically, and she's right. So if you've ever wanted to get loud in the face of management, now is the time, to put the pedal to the metal, or whatever, rubber to the road, whatever your particular metaphor is for, and digging deep and getting things done. That's where we're at. And the negotiations team is going to need you.
All gas and no brakes, people. All gas, no brakes, right, Maureen?
That was Marsha, yeah.
So my dear friend Sarah of Voc Rehab put in the chat about the strike in 2001, and then Mary Ann asked how that turned out. That strike is actually what won us CGIP in the first place. We had a much crappier health care plan, it's my understanding, before that time. And CGIP is what we won from that strike. And so sometimes you have to defend stuff. And the best way to avoid a strike, which is what our goal here, I want to be clear, our goal is to avoid a strike, and the best way to avoid a strike is to be prepared to withdraw your labor.
Exactly.
And so, like, I want to be clear. I went on strike with the nurses in 2022. I am not interested in going out again, but I'm willing to do what we have to do. The other thing, too, that I want to talk about, and I think this just goes to show how tapped in and well-educated Region 5 members are, that I haven't gotten this question, is what are the other unions doing about this? Didn't get that question, gonna answer it anyway, because I'm assuming some folks are thinking about it. So we negotiate our healthcare in coalition with all of the other unions that represent workers in the state, including AFSCME Council 5, AFSCME Council 65, the Minnesota Managerial Association, the Minnesota Nurses Association, the Teamsters, the state troopers, who may be Teamsters. I can't remember how those all work out. There's 12 other unions besides MAPE that we negotiate in coalition with, and this coalition is committed to not accepting this crap that was proposed to us. I don't think that there's anybody in the coalition who is even remotely willing to entertain it, to the point where the sort of smaller, maybe sleepier unions actually had people out in front of AFSCME Council 5 on the first day of healthcare negotiations for the first time ever for some of them. So this coalition is committed, but we are only as powerful as you all are.
I saw in the chat.
Hi, folks. I have to just cut everybody short just for my end, but keep talking. I have to log off our MnDOT supplemental caucus here in a minute, but I just want to say, stay strong, stay firm, fight. We don't have to take this. Kirsten, Maureen, and I will keep you posted. And like I said earlier, all gas, no brake. Put the pedal to the metal as we ride out May and June, folks. And in solidarity, see you soon.
Thanks, Gabe. I did see a question in the chat. Where can people find the recording of this call? And this will be posted at both regions, just like the last one was, and also at the Deed Meet and Confer. So if you just go look, where's my local, and put your name in, it'll be there. If you're not in Region 5, just go to the Deed Meet and Confer, and it'll be there too. So, or you can pretend you're in Region 5 and go look there. So, because we're
This is Rob. I have a question.
Yeah, go ahead, Rob.
So I didn't see any of the numbers, but are co-pays going up as well? And if they are, do we know, like, did they propose how much they would go up? And then
Rob. Oh, sorry. Go ahead.
What the changes in medication? I know you guys said would go up dramatically, but what are those numbers, if there are any?
Yeah, I think we are working on an accessible version of this. The PDF that the state provided was not accessible, shockingly, for how much they. Anyway, so for office copays, I'm going to just list off for cost level 2 and 3 because that's where most members fall.
But
it'll give you a sense. Is it okay?
No, that's totally fine. Thank you.
Okay, so for like your office visit, primary care, routine care, they want to bring your copay from the current $40 in cost level 2 up to $60. This again, just primary care. If you're in cost level 3, they want to increase it from $70 to $90. For specialty visits, they want to increase it again from $40 to $60 for cost level 2. And then for cost level 3, they want to do the same thing, bring it up from $70 to $90. For hospital services, this is the one that is the real stinger. So for your outpatient surgeries, if you were in cost level 2, previously it was $120 flat copay for cost level 2 outpatient surgery. They are proposing that become a $300 copay. Inpatient hospital services on cost level 2, they want to go from $200 to $400. And emergency rooms, they want to take from $125 to $350. That's all in cost level 2. In cost level 3, this is even worse. They want to eliminate the copay entirely for outpatient surgery. So that's like going to get a mole removed as outpatient surgery, right? They want to take it from $250 to a 30% coinsurance. So you would have to meet the $1,500 deductible and then pay 30% of the cost after that if you're in cost level 3. Inpatient hospital is the same thing, and then they want to increase the ER copay from $150 to $500 if you're in cost level 3. For prescription drugs, they want to pretty much double and triple all the copays. So for tier 1 prescription drugs, and this is for all cost levels, it doesn't change. For all cost levels, they want your tier 1 drugs, your cheapest drugs, to be $30 instead of $18. They want your tier 2 drugs to go from $30 to $75. And they want your tier 3 medications to go from $55 to $150. And then if you're on a specialty medication, so if you're somebody who has cancer or is being treated for like an autoimmune disorder, those drugs tend to be specialty drugs. And rather than just applying to your out-of-pocket maximum, they want to assign a 10% coinsurance after meeting a new $250 deductible. They haven't quite explained how that works. How are we going to have deductibles, out-of-pocket maximum, and copays? I don't think that they've thought this all the way through. So that's sort of like the highlight of the cost that they want to increase. They also want to increase the overall out-of-pocket maximum to on cost level 2 to $2,500. And then if you are on a family plan, they want to increase it to $5,000. If you're on cost level 3, they want to increase your out-of-pocket maximum as a single person from $2,400 to $3,000. And then they want to increase, if you're on a family plan, from $4,800 to $6,000. Sorry, it's hard to listen to a P rammer there.
Last I checked, we work for the government and we can't afford those rates. It's not possible.
Correct.
I know people who work for other corporations such as Target Corporate and other corporations where they make a lot more money than we do, and their insurance is not nearly as good as ours, but their copays are insane.
Yeah.
Wow.
Yeah. I mean, it would unwind all of the raises that we've seen for our lowest paid members. This is tantamount to a 7% pay cut. Even for our higher paid members, this is like a 3-4% pay cut, right? Easy to absorb if you're sitting as a executive C-suite person at MMB making $175,000 to $200,000 a year. Less easy to absorb if you're in the call center making $50,000.
Yeah. And just to kind of, highlight some of the things that both Kirsten and Gabe have been saying today. I mean, there's not a whole lot we can do about that premiums are going up. Even if we change nothing, we'd have an increase in premium. But when they start to really pass along the share of what we have to pay to us, that's where it really gets odious and really gets repugnant and really says that they don't value us. So, I'm with Kirsten. I don't really want to strike, but I will if we have to. And I'd rather we just get dang ready and scare the crap out of them so that they know that they can't do this to us.
And the good news is, so that was very depressing, and I'm sorry for that. The good news is that I have been to, I would say there's 21 regions. I have been to probably like 11 or 12 of them at this point doing meetings just like this. I have not been to a single region, greater Minnesota, metro, suburban, where they are not as mad about this as you are. This is something that hits everybody. Everybody's upset about this. You are not alone in feeling the pressure of this. And we are stronger together. So when everybody is feeling this, that's where our power comes from. And so while it does suck and it's a bad proposal, it is just a proposal. This is the state's opening offer. And as long as we stay solid and stay mad, we're going to be able to beat it back. I fully believe that. We might have to fight a little bit harder than we're used to fighting, but we can do it. We do hard things every day in the state.
Okay. Were there any other questions about this or anything else that's going on?
Caroline has a chat about moving a provider from a cost level 2 to a cost level 3. The way, I'll try not to get too wonky here.
Go ahead and get wonky. These are wonky people.
Okay. So the way that our cost level assignments work is based on the it's based on the rates that providers negotiate with Blue Cross and Health Partners. Then CGIP then takes those negotiated rates between the provider, Blue Cross and Health Partners, and says, okay, this rate falls in the top 10% most expensive rates. And you pick on the Mayo Clinic. Therefore, the Mayo Clinic in Rochester on its own is a cost level 4 because they are the most expensive. It decreases from there. So we have the clinics that are willing to take a little bit less money per claim in order to access the 60,000 people that are in our health plan. It's a big patient group, right? Those ones get lower. So you can't dispute it through CGIP. However, relatively recently, there was a good amount of success up in Fargo, like Fargo Moorhead. There's an Essentia Health up there where they went from a tier 2 to a tier 3, and the state workers up there absolutely rioted. They went directly to the hospital and said, "Screw you! You're like, this is ridiculous. We need to get our care here. Drop your rates, the 2% that you need to drop them to get down into a tier 2." And they put so much public pressure on that hospital that they caved and they went back down to a tier 2 and they renegotiated their rates.
Yeah.
So can't do it directly with CGIP, absolutely can target the facilities. Hopefully that wasn't too wonky. I'm sorry.
Yeah, but that was a success story. So,
Huge win.
it could probably be replicated.
Yeah, huge win, absolutely. I think probably with anybody but the Mayo Clinic, who does not have a reason to negotiate.
True.
This is Rob. Also, I heard that a lot of the outside of the metro area employees don't really have access to a tier 1, where tier 2 is the lowest. And in some regions, I think what happened up in, what would you say, Fargo area, was that after they started the new year, there was no cost 2 option. It was 3 and higher. So I'm glad that they were able to put back and get that changed. But this is going to impact so many people.
Yeah, that's absolutely right. And that's like not even counting the access issues in greater Minnesota to specialty providers, period, as these big hospital systems consolidate and move all their specialists into the metro. So we're losing specialists in greater Minnesota, then we're losing them in the metro, and the lines get even longer. It gets even harder to access care. We're not going to be able to fix the state of healthcare in Minnesota through our contract, but we can do everything we can to protect ourselves and our families. We are exploring some creative solutions with CGIP. I don't know that we have had any workable ideas come from MMB yet, but we've only had 2 negotiating sessions with them. We'll have another one tomorrow. So if you have any ideas, if you're a healthcare wonk like I am, and you have any ideas for what kind of changes we can make to the plan that don't necessarily include taking increases, because I'm not particularly interested in taking increases. But if you have any ideas, if you're wonky like I am, please, please, please reach out to me, reach out to Gabe, Maureen, Carolyn, Kristen. There's nothing wrong with taking a creative approach to solving some of these problems. How will this affect dental and vision? So our dental plan is actually doing pretty good. We're not expecting any changes to dental. They're not proposing any major changes to the dental plan. Our dental plan is solvent. And vision, I wish I had a good answer for vision. We're asking them to find a new vendor for vision. We'll see where that lands. Vision is handled differently than dental and medical in the way that we fund it, because it's all employee funded. So it's a matter of deciding, like, do we want to take a more expensive vision plan and ask our coworkers to shoulder that cost? Or do we continue with the sort of middle of the road low plan that we have currently that's less expensive? Yeah, your eyes and teeth, those luxury bones are real spendy.
Yeah. Okay.
So dental's doing good. Dental plan, totally solvent. No concerns there from the employer.
So just to reiterate, you're meeting tomorrow, right, with CGIP? Yeah.
Yes.
And then we're all meeting with MMB on Friday to talk about some of the more lovely regular proposals, that we're talking about. So, just keep your eyes open. If your cat reaches out to you, if the contract action team reaches out and says, "Hey, we've got an action going on," participate, please. Do the thing. Show up to the things, you know. If we text you, I assure you, even if it looks like a program text, that's us. There's a human being behind that person send on those texts. I mean, we may be texting the same initial text to everybody, but it is us doing that texting, and we're reaching out trying to let you know what's going on and to get you involved. And
Yeah.
please apply. It makes our day when you do.
It's going to look like a spam text. It's going to look like a political message that you get, but it is us sitting there hitting enter 5,000 times, or however big your local is. We're sitting there hitting enter saying, yes, send this message, send this message. So there's a human, it's your negotiator, or
Yeah.
me.
And yeah, and then if you respond, we get back to you with answers. We'll actually respond. So
Jessica asked about wages. We won't even talk about wages or cost of living until push week, probably, maybe a little bit before, depending when we get a budget, which is
budget.
also confounding to me why they are bringing these massive cuts forward when they don't even know what the budgets are. And they're not prepared to talk about wages. So why should we talk about healthcare costs? We'll negotiate in good faith, but it's hard to reckon those two things.
Yeah. So yeah, across the boards they won't discuss those with us or anything financial really till we have that budget. But we've put a pin in those, and they will be discussed. And that is typical, just so you know. It's just that, say last year, it was a lot easier to arrive at a budget than it was this year. So it wasn't really in question whether or not we were going to get around to discussing those things. And we will get around to discussing those things. It just might be later in the summer than we hoped.
Which is very normal. Like this is very normal. At least this part of it is that we talk about healthcare changes. The last 2 cycles, they have not been that bad. The budget also has not been this bad. So don't freak out. We are all in this together. There's a lot of experience in this room. There's a lot of experience in your local and on your teams. We're going to take this one step at a time. We're going to put one foot in front of the other. In the meantime, you can join the cat. Also, you can just talk to your coworkers who you don't see in this meeting today and let them know what you saw and how you feel and ask them how they feel. That conversation might not seem like you're doing much. It might not feel like you're doing much, but if a lot of people are having these conversations with their coworkers, management's going to hear about it and it's going to work its way up the chain to MMB. And we need them to know that people are mad. There's a lot of different ways we can do that. And one of the easiest ones is just talking to your coworkers. So
We've
don't
had a
freak
couple
out.
questions
Don't feel
about
afraid.
MMB taking away our on-call pay. And no, I don't project that that's going to happen this contract.
Yeah, they don't have a proposal about that, do they?
No,
I don't
not
think they
that.
do.
And then going up here, somebody had a question about, do the steps go up with each COLA each year? Yes, they were trying to take away step increases being automatic, or at least making us have to negotiate them each contract. But the way it stands right now, and the way I expect it to continue, because they did drop that one, is that, didn't they? I think they did.
They will if they hadn't. We're gonna make
Yeah,
sure.
that one's going to be gone if it's not gone already. But your steps are separate from your COLA. So if you get a step increase, you can get a step, and it's actually not really a COLA because a lot of them do not represent the actual cost of living. They're called an across the board, but the across the boards are effective July 1st. And in the first year of a contract, they usually come later and then are retroactive July 1st because it takes a while to implement a contract when we get one. And that's assuming that we reach TA before July 1st. Even so, if we reach it after, it'll be a little longer. It's not as long as it used to be because we no longer have to, now I'm getting wonky, take it to the SER, which was the State Employee Relations Board, and have them make a political football out of it. And then if they punted it sometimes, to stay with the football metaphor, it would be like the, next spring session of legislative session before we'd actually see our increases. So, close to a year of retroactive pay. That will not be the case because it's now between us and the executive branch. And so it's really when we reach a TA, then we have to vote on it, and if we agree to that contract, then, it takes MMB a little bit of time to implement it and get the raises on, and then we'll get our retroactive to July 1st and anything that we agree to. So COLAs are on like the anniversary or around your anniversary. I'm sorry, the other way around. Step increases are around your anniversary. And as long as you're still eligible for a step increase, because at some point you do reach the top, but as long as you're still eligible and nothing's made you ineligible for that step increase, that would just happen and it would be separate. Does that help, William? Good.
The person who said that all your coworkers are new hires, all of us are new. That's going to be a very scary situation to be in. I'm sorry, I didn't know that. I would say if you are comfortable, message Maureen or Kristen or Carolyn. You can message them privately. You can put it in here. Put your name. Put what like division you work for, so that we can get somebody who has been around a while to come talk to folks there. I'm very sure that people are willing to do it because we've all been new employees at the state at one point during contract negotiations too, and have been scared. So I don't want you to feel like nobody's here for you. Message some of those folks and they'll connect with you and help you kind of talk through the details of how things go. 'Cause I've been there, Maureen's been there, we've all been there. It sucks. It doesn't feel good.
Oh gosh, I was temporary unclassified my first couple years with the state. So like we went through a whole contract negotiations and people had frozen steps the previous one, and it was really scary. So it was the last time that we had a recession, but we came out of it and we started getting increases, and we're gonna not let them push us around this year, especially if we have you standing behind us.
The line in the sand for healthcare costs. We don't have like a specific line in the sand. We're just not interested in absorbing the employer's mistakes. It's not on the, it's not on the workers to balance the employer's budget. And that's my line in the sand. I don't know. That's vague and unsatisfying, I'm sure. But
yeah,
it's ridiculous. It's ridiculous that they want us to balance their budget for them. So
they have a responsibility to raise some revenue if they don't have it.
Yeah, there's plenty of giant corporations in Minnesota that aren't paying taxes at all.
But Kirsten, they'll leave if we make them pay taxes.
That's what the governor believes.
Okay.
Period. Yeah. So anyway, I have to hop off. It is so lovely. I love coming to Region 5 whenever I can to see the old names that I saw from my deed days. It definitely makes me reminisce.
Yeah.
So
this is actually open to all of deed too. So you have people outside of 5. You have 5 plus, some deed.
Oh boy.
Yeah.
I promise I won't yell at you like I used to. That's Maureen's job now. So thank you all so much. I am just, I'm so proud of our union. I left for 2.5 years to go work for the Minnesota Nurses Association, and I came back to a totally different union. I've never been more proud to be a MAPE member than I am today. We all have come so far. We've done so much work. We've got more to do, to be sure. But I just couldn't be prouder. And we had like almost 200 people in here at one point, and that just warms my cynical little heart.
Yeah. Our initial one, we got up over 200, and I hadn't seen that in a very long time. So.
Yeah. So stuff is hard, but remember, we are doing great work here. We are a different union than we were 4 or 5 years ago. And that is something to be proud of. And we're going to continue to fight, and we're going to continue to stick together and stand up for Minnesota.
Because we all know that we're the people that get the things done for the residents of Minnesota. When people talk about how great Minnesota is, it's because of the work that we all do. I mean, it really is. And it just makes me so proud. Yeah. And they need to continue to fund us at an appropriate level to make us a great state to work in and to be in. So.
Thank you all for being here. I'm going to hop off. There's some emails in the chat. You can find me. I think I'm the only Kirsten. Just make sure you spell it K-I-R, because there's a Kristen Peterson at the PCA who is a delight, but will be very confused if you message her.
He is very delightful, though.
Okay, toodaloo. Bye, everyone.
We'll see ya. We've got about 10 minutes if you have additional questions. If I don't know the healthcare because I wasn't there, I'll, get it from Kirsten and Gabe. But anything for regular negotiations, I am sitting at that table with them. So we also have at least Carolyn and Kristen were here. If they're still here, they can help me out with that too. So otherwise, I'll give you back the rest of your afternoon, and this recording will be posted within usually takes communications to get it about a day to get it out there for us, sometimes two, depending on how busy they are doing other things. But we'll post it for anybody who didn't have a chance to come. Did we miss any questions from anyone? Drop it in
There
there.
was a question about the executive order. I think really with that one, as with all the executive orders, it's important to remember that the only office that has to listen to the EO is the executive branch of the federal government. So what that means in terms of the actual like impact on prescription drug prices is at best a wait and see, I think.
Yeah, unfortunately. Or fortunately, depending on how crappy the EO is. So thank you all so much for coming. Look for ways to get involved. I hope to see your shining faces at a rally. If you need a t-shirt, reach out. I can get one for you. And we'll make sure that you have something to wear if you come to said rally. Thank you. You have a good rest of your day.